Your employer has implemented a gap plan with SIS, and we are going to go over how this insurance plan works and how it could benefit you and your family if you decide to enroll. The gap plan is designed to complement your major medical plan by helping to cover your out-of-pocket expenses, such as deductibles, and/or coinsurance. The gap plan offers benefits to help cover hospital stays and outpatient services. In order to be eligible for the gap plan, you must have a major medical plan in place. The gap plan has no clause for pre-existing. In order for a condition to be eligible under the gap plan, it must be eligible with the major medical plan, medically necessary as a result of an accident or illness, and apply to your deductibles, and/or coinsurance. Some of the charges that are covered but not limited to are eligible hospital charges when admitted 15 hours or more, outpatient surgery in an outpatient surgical facility, emergency facility or physician's office, diagnostic testing including, but not limited to, X-rays, diagnostic lab, MRIs, and CT scans, outpatient radiation therapy or chemotherapy, and physical therapy or chiropractic care. Let's take a look at an illustration example showing how the hospital confinement benefits help cover eligible out-of-pocket expenses. The following example illustrates how hospital confinement insurance benefits would be paid when a gap plan is combined with a high-deductible group major medical/comprehensive plan. This example is for illustrative purposes only. Each insured person's experience under the coverage may be different based on the plan selected in their specific situation. In the example above, the insured person's responsibility under a low-deductible major medical plan is $5,000, $1,000 for his deductible and $4,000 for his coinsurance. However, with the implementation of a gap plan that includes a $5,000 hospital confinement insurance benefit, the insured person can save $5,000, eliminating his total out-of-pocket responsibility entirely. Now let's take a look at an illustration regarding how the outpatient benefits help cover eligible out-of-pocket expenses. The following example illustrates how outpatient benefits would be paid when a gap plan is added as a companion plan to a high-deductible group major medical/comprehensive plan. This example is for illustrative purposes only. Each insured person's experience under the coverage may be different based on the plan selected in their specific situation. In the example above, the insured person's responsibility under the major medical plan is $1,160 for expenses applied to his deductible and coinsurance. However, with the implementation of a gap plan that includes a $2,500 maximum outpatient benefit, the insured person can save $1,160, eliminating his total out-of-pocket responsibility entirely. In order for us to process any claims, our claims adjusters will need an itemized bill that has the CPT and diagnosis codes printed on each bill, and the primary insurance explanation of benefits. The primary insurance explanation of benefits needs to show us how the claim was processed and what amounts were applied to the insured's deductibles, and/or coinsurance. If the insured has to pay for any portion of the charges, we also ask for a copy of a paid receipt in order to reimburse the insured. In efforts to make this an easy process, please have the provider call the number on the back of the ID card, and ask for our customer service department. We will give them all the information needed to submit their claim directly to us instead of the insured having to submit the claim. We require one completed claim form per insured per calendar year in order to process claims. After the provider submits their claims to us and we have the yearly claim form and had the opportunity to review all submitted claims, we will send the insured our explanation of benefits that will show how the claims were processed with SIS.